My name is Dr. Matthew Weir. I'm a professor of medicine and chief of the Division of Nephrology at the University of Maryland School of Medicine in Baltimore. I've been practicing nephrology for many years. In this coming July, I'll have been at the University of Maryland School of Medicine for 35 years. The real opportunity with providing on-site home hemodialysis, so to speak, in these skilled nursing facilities is that it lessens the need for transportation. Now, this is a lot of work for patients where they need to be bundled up, trundled down to a waiting ambulance, or they may wait an hour. They then get put in it, transferred to a facility where they may wait again before being transferred to a chair, dialyzed, being transferred back to a waiting van, again, hours in between. I mean, you may have a 3.5-hour dialysis treatment, but you may be gone for 10 hours by the time all the transportation and manipulation has been done. The other advantage really is that by getting 4 shortened treatments per week, there is less volume overload. There is a marked reduction in medications required, especially for blood pressure. Less medication, fewer side effects, improved well-being, better sense of being able to breathe. Many factors that play a role that facilitate the rehabilitation process and make people feel better, stronger, and capable to get out of the rehab center and then obviously back home again. The opportunity for patients to, in a sense, facilitate overall long-term improvement of care has been an exciting opportunity for us. I remember a lady who received a liver transplant after sustaining a fall where she broke several bones and was in the hospital for many months after her liver transplant due to some medical complications and, of course, her orthopedic complications due to her bone fractures, who ultimately had to go to a rehab center. Because her kidneys had failed at the time of her liver transplant, she required dialytic therapy. We were able to maintain her at the skilled nursing facility on dialysis as she proceeded with her rehabilitation, and it was remarkable to see her improve. She subsequently was able to go home. We ultimately were able to get her listed for, and then subsequently she received a kidney transplant, and has subsequently transitioned back into a normal life, so to speak. It's this type of opportunity that really gives us the greatest thrill in seeing our patients improve in terms of their overall quality of life. And I could go on and on. We've had more than a half dozen patients who've received successful kidney and/or kidney-pancreas transplants just in the last 6 or 7 months, and all have progressed beautifully. And I might say the real advantage here is that the home systems that we utilized to facilitate their care in large part helped improve their overall health, their cardiac function, and I think in large part allowed them to be better subsequent transplant recipients.